Okay, in this video, we'll be doing the newborn reflexes. So what you want to do, you want to come in the room, you want to introduce yourself, you want to explain the procedure to the mother of what you'll be doing. You want to, check the name, the date of birth. You want to perform hand hygiene. You also want to check the doctor's orders, and you want to explain the rationale to the patient that you're checking for reflexes, that these are things that the baby is born with in order to help them survive. Okay, now that you've done that and you have on your gloves, also you want to use latex-free gloves if the baby has any type of allergy to latex, and it helps to reduce microorganisms. Okay, so the first thing that we would check for is the moral reflex. Okay, so the moral reflex, or like the startled reflex, it's like if the baby is startled or dropped, you would do something to kind of startle the baby, and what would happen is the arms would the arms would fling out and come back in, as if the baby was like groping for support, or like trying to grab for support. Yeah. Okay, so the next thing is called the rooting reflex, and you can pretty much do the rooting reflex and the sucking reflex together. So with the rooting reflex, you want to stimulate the side of the baby's cheek, and this will prompt the baby to turn their head. This gets the baby in preparation for getting ready to feed, to suck. And so if you have like your finger or your breast or a bottle, when the baby turn their head, they'll start so you would use your finger, like they'll start sucking on your finger, or the breast, if that's what's near, to start feeding. And that's the rooting and the sucking. Once the baby starts sucking, you're able to check that reflex as well together. So the next one is the plantar plant no the I'm sorry, the palmar grasp. So with the palmar grasp, like if you put any pressure on the baby's palm, it will prompt the baby to grip like your finger. The baby fingers will curl over, and it will grip your finger. Okay, so the next thing you would do is, well, the last two that you would do would be the plantar grafts and the Babinski reflex. I think I said that right. Babinski reflex. So what you would do, you would get the baby's foot, and you would stimulate the baby's foot. So with the plantar grafts, the baby toes would curl inward, kind of like the palmar grasp, but instead of with the hands, with the feet, the baby toes would curl inward. And then with the Babinski, you would stimulate the baby's foot, and the toes would fan out. The toes would flare out, will like come apart and flare out. And then I got one more. Toes will like fan out. Yeah, the toes will fan out, And the last one is, which one I didn't do? Oh, the stepping. Okay. So with the stepping, you would hold the baby up, like this. And when you hold the baby up, it would they will start stepping as if, like, they're trying to walk. But that is the stepping, where they're moving their legs and their feet like as if they're trying to walk. Okay, and that would conclude the video on the newborn reflexes.